Healing Hurt People is the only hospital-based program that is trauma-informed. Or I should say, we are the first trauma-informed hospital-based violence prevention intervention program. It required buy-in by the hospital administration, and we see our work going in, it's bi-directional in some ways, in that we're providing direct services to patients/clients, while at the same time we're educating other healthcare providers, public health professionals, around the importance to embed trauma-informed practices in their day-to-day activities. Something that's really exciting and important is our opportunity to expand this work into other level 1 trauma centers across the city. Philadelphia is interesting in that we're a population of about 1.5 million, and we have roughly 5 level 1 trauma centers throughout the city. And I'm missing one of the pediatric facilities. And so our goal is really to make this a standard of care, in that we have professionals that are working with what would be considered a marginalized population to get them into primary care so that they're not overutilizers or superutilizers, but get to take advantage of the services that they're deserving of.
So the Philadelphia ACEs Task Force began in, I think, around 2012, and it was initially spearheaded by an organization called the Institute for Safe Families, which had been working for many years on how to prevent interpersonal violence and at multiple levels, and had really, similar to my experience, found the ACE framework to be an excellent way of kind of connecting the dots in the work that they were doing. And they had also had a lot of focus on working in pediatric settings to really try to promote screening for domestic and intimate partner violence in pediatric settings, and help, in particular, healthcare providers develop the skills and capacity to work with families who were experiencing interpersonal, intimate partner violence. And I think the work in those first 2 years had really been around networking, around awareness building, around coming to some shared vision and understanding of what we wanted to do in Philadelphia. And a primary actually task that was accomplished in those initial 2 years was the Philadelphia ACE survey. So that gave us some real data and information about what do ACEs look like in Philadelphia.
I believe fundamentally that trauma has the potential to fragment communities. I've also seen how trauma and trauma-informed care has the ability to bring fragmented communities back together again. And under the umbrella of trauma-informed care, I've seen disparate communities of helpers, be they substance abuse or chemical dependency programs, homeless shelters, behavioral health centers, violence intervention programs. I've seen how a trauma-informed umbrella actually promotes greater levels of understanding and cooperation among disparate organizations and helpers.
One of the other lessons that we learned was that the community was ready to take the tools back immediately. So after developing a plan, they really wanted to begin to use these tools. And so they began using community meeting in their own organizations. They began using self-care plans. They started having community workshops that really discussed some of the topics that we discussed related to sanctuary. So there really were a number of lessons that we learned that individuals really are ready for this type of information. Individuals really have a need to really become more trauma informed and really understand how trauma impacts the brain. I think that the community leaders really felt that that information was critical, and they wanted others to know about that information and how the brain is impacted by trauma. Those lessons really taught us that more needs to be done, and that the community leaders really are the ones to probably lead that charge.
when you ask what kind of lessons are learned from understanding trauma-informed care or trauma-informed information, I think it's part and parcel of the changes that are going on in the justice system. We have specialized courts now, like mental health court in Philadelphia, and drug treatment court, DUI treatment court for drunk driving cases. In order to have those kind of programs and others, you need to understand people and understand what they've been through and who is appropriate to go into a program like that, whose purpose is to try to deal with the issues and problems that brought them into the criminal justice system and prevent them from coming back. So I think that that kind of information and understanding how the brain works and how the brain works when exposed to trauma and why people may act in certain ways is very useful information to use in the court system, and hopefully can also be utilized in the prisons, so that when people get out of prison, if they've been able to have that kind of care or program shaped with that in mind, it can change their conduct in the future and prevent them from coming back into the criminal justice system.
The changes I've seen in terms of trauma-informed care, I think that I probably think about several different sort of entities. Certainly there's, programs that we have in terms of Sandy Bloom's work. There's issues in terms of healing hurt people, in terms of gun violence. There's really institutionalized approaches that our 11th Street Corridor has incorporated, and as a board member of Women Against Abuse, I've seen firsthand people not only understand about issues of trauma, but really sort of go through that certification process to say, from the ceiling to the basement and everywhere in between, this is how we're going to move forward. And the pride when people can sort of achieve that level of certification, knowing that anybody comes through the door is going to be treated in a certain way.